Next, Dr. Ajay Aurora, sir. Over to you.
Thank you, ma'am. Thank you, chairpersons and honorable judges. Can I have my... Yeah. So I'm presenting on to evaluate efficacy of centrifuged triamcinolone in suprachoroidal space in macular edema. Part of this work was done at the SEM lab at IIT Delhi. We know that suprachoroidal space is a potential space which is located between the outer layer of choroid and inner layer of sclera. Its potential and hence it's difficult to reach this space. You need proprietary micro needles. So there are various micro needles available, but Clearside biomedical micro injector system and a jugaad which is created by combining a 23 gauge and a 30 gauge needle. But this has got its limitation and manufacturing problems. So we decided that can we use a normal 30 gauge needle and inject through a device. So you can see here we did some animal studies initially, and this device is being used to inject triamcinolone into the suprachoroidal space using a normal 30 gauge needle. And this we have now done in 128 eyes. So this was the initial patient, a 58-year-old obese female who had persistent diabetic macular edema, had received multiple anti-VEGF injections on Ozurdex, and when Ozurdex was not available in the country, she came to us, and we decided to inject triamcinolone into the suprachoroidal space after the due consent. And you can see here beautifully on the 14th day the macular edema had reduced, and this lasted till 88th day. So then we decided to extend the time for triamcinolone by centrifuging and removing the supernatant and injecting the pellet inside the eye. And we had 16 eyes of 14 patients which were taken. All underwent centrifuge injection of cTA of 0.75 to 1 ml. They were put on topical anti-glaucoma drugs for about 2 weeks. One patient required a filtering surgery. There was no retinal-choroidal injury, and the edema came down in 7 to 30 days and remained edema-free for about 80 to 158 days. This is an example of a patient with vitritis, with patient of tuberculosis. The cTA was given. The vitreous cavity cleared up. Patient's visual acuity improved. This patient was a non-infectious uveitis. We gave a normal standard triamcinolone. The effect lasted for about 4 months. You can see how beautifully the edema is reduced and the visual acuity is improved. The same patient we injected centrifuged triamcinolone, and you can see here that the effect lasted for about 8 months, which is 5 months more than the cTA. There is no drug available at this point of time anywhere where the effect lasts for 8 months. Imagine having just 2 injections in a year. The same patient we subsequently gave 1 more injection, and this effect lasted for 7 months. So if you compare the economics and environment friendliness between Ozurdex and cTA, the country will be saving about 149.76 crore rupees annually if they used only cTA. There is also minimal plastic utilization, and in case we use the centrifuge triamcinolone, this saving can become 250 crores. So I'll conclude that suprachoroidal injection of triamcinolone is a safe method, and it is not only that it saves a lot of money, it is environmentally friendly. Thank you.
Sir, it was a very nice presentation. Sir, did you face any complication like perforation in the method that you followed?
So the only complication which happened initially was that the injection, instead of becoming suprachoroidal, becomes intravitreal, because we are injecting at 4 millimeters, 3.75 to 4 millimeters from the limbus. So that's a complication which we anyway give an intravitreal triamcinolone, so that's not a complication at all. But I was afraid of creating a choroidal hemorrhage, but that did not occur. And now that we have, actually now I have taken it to the next stage where actually there will be an electronic signal the moment you go into the suprachoroidal space, but that is not part of this presentation.
Okay, that's great, sir.
Thank you, sir.
Thank you.
I would like to call the next speaker, Dr. Narendra Singh Verma.
Yes. So we did UBM analysis on these patients. It's very surprising that once we inject the drug, and so we did animal studies and then we did human studies. Within 45 minutes, we are hardly able to detect where how the drug has spread all over the suprachoroidal space. So on a UBM also it is difficult to detect. It becomes such a thin sliver. Then we went ahead and injected methylcellulose and halon into the suprachoroidal space in animal studies where we could expand it. That also gradually settles down. The triamcinolone is such a thin sliver that you can't make out on UBM. I cannot see it on an indirect any mount anywhere.